Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I'm going to be talking about massage, otherwise known as manual therapy in the physical therapy world. When to use it, how to use it, why we do it, why some don't. There's a lot of myths in this world, a lot of confusion, and a lot of therapists, quite frankly, that think we shouldn't even use it. So let's start there. So why not use it? So I see online in places like Instagram, Reddit, social media in general, a lot of therapists saying that there's no evidence for manual therapy. Well, first of all, there is, and I'm going to talk about anecdotal in a minute. There is actual peer-reviewed research on it. But even if there wasn't, just because there's a lack of evidence doesn't mean it's contraindicated. I would say, bare minimum, there's anecdotal. So anecdotal evidence is like what I see as a clinician. So that's a low level of evidence, sure, but still I see it work really well. So we can't really ignore that. Plus, people do want it, and I think if it makes people feel better, it's worth doing. Now, I'll say that also in the insurance world, a lot of therapists are just burnt. They're just run into the ground by these clinic owners and insurance company demands. So a lot of them are seeing 2 or 3 patients at the same time, with something like 30 patients a day or more even in some cases. And they have to document on all those people and justified insurance. So that's that's like writing like 30 papers a day. So I just simply don't have the time. So, I think both those things matter is, maybe you get newer clinicians. I know when I first graduated, I was much more of a skeptic about everything, and everything had to be evidence-based. And that's just the way we're trained. But as, I've been at this since 2010, the whole physical therapy journey, and as you get deeper into it, you learn there's more to rehabbing somebody than just the evidence. So the coupling of that idea of evidence plus just burnout, I think, has led to this push for a lot of therapists not using manual therapy as much. Now, I will say, can you get someone better just with exercise? Absolutely. Can you get there maybe faster with manual therapy? I think so. Can you make it more comfortable for people if you use some manual therapy? I definitely think so. So what does massage or manual therapy do? Well, let me start off with what it's not doing. We are not breaking up adhesions or breaking up scar tissue. That's an old myth that's been debunked countless times. That our hands are just not that strong to do that. It takes a lot of pressure to make a plastic change to a scar. Now, maybe when you have a brand new scar and you can mobilize the scar, you might have some effect there. But if you've got like a knee replacement that's 6 months old and you're missing range of motion, I don't care how much you massage that knee, you're not going to break up the scar tissue. So what are we doing? I mean, that can be a long-winded answer, and there's multiple effects. But I think the biggest effect is on the nervous system. We're talking to the nervous system, and this gets into a little bit of what's called pain science. So pain is super complicated, super fascinating. It's your body's alarm system. So when it detects that something is going on in an area of your body, just like the dashboard in your car, like, hey, that tire is running low, it says right here in that knee, your ankle, wherever, something is going on there that I don't like, some sort of metabolic waste or some thermal change, some sort of mechanical change, and I'm going to be sensitive to that. I'm going to hypersensitize or become more vigilant to that area. So it turns up the sensitivity dial to that region in an attempt to kind of get your awareness around it and get you to move different or not do the thing that's provoking it. That's what pain really is. So it's a signal from a brain to that area. I'm not sure who said it first. I think it was Perry Nicholson, but I love this quote. Pain is your body's request for change. So when we do massage, there's different inputs we can put into the nervous system because you have all kinds of receptors of nerve signals, basically. And the more you can stimulate the nervous system in that region that's not feeling well, and the net effect being nothing bad has happened to you, what happens is the nervous system turns down the sensitivity dial, albeit temporarily, but it does it for a period where you now have an opportunity to work on something, restoring whatever is missing, the range of motion, the strength, probably both. So that's the main reason we do it. Are there mechanical things happening? Sure. Are we pushing blood around, affecting lymph? Sure. Are we improving the sliding surfaces like the skin, the fascia, the muscles? Those layers can sometimes get kind of stuck together, and maybe we create enough shear to maybe improve some of that. That's probably happening too. But the bigger effect is on the nervous system. So what massage I do and why I do it changes. They certainly overlap, but it's probably like 3 buckets I'd put it into. By far and away, the biggest one is what I just talked about, desensitizing something that's become sensitive. I will also use manual therapy to improve range of motion because stiffness in muscle, which is controlled by our nervous system, can limit your range of motion. So that's kind of on the musculoskeletal side of things. And then I will also use it for swelling. So I'm talking about the lymphatic system. So the state of the patient and what I'm trying to address dictates what type of manual therapy I will use. So if I got someone like a nice hot injury, just off the street, acute pain, can barely move, they're chest breathing, they're clearly in a sympathetic state, I'm going to choose something to calm the entire nervous system down, to have a systemic effect. So I want to trigger the parasympathetic nervous system, right? So you just herniated a disc or something like that, or maybe you just tweaked your back muscle really badly and you can barely move. You're in fight or flight. Your body is just pumping with cortisol and stress, and you're basically going to a sympathetic overdrive. So I want to use my hands and breathing, by the way. These things go together. I'll probably first start off with getting you to calm down your breathing, slow it down, do diaphragmatic breathing because that greatly stimulates the parasympathetic nervous system. And then I'm going to use what we call effleurage, which is like a light massage, the feel-good massage, kind of think like a Swedish massage. That can greatly stimulate the parasympathetic system. So you pair that with a breath, and it gets everything to cool off. So remember, the nervous system controls the tone of your muscles. So I'm kind of speaking to the therapists right now. I'm hoping some therapists are listening that maybe don't use manual therapy and don't understand why. This is, I think, to me, one of the greater effects is we can change the autonomic nervous system to be more parasympathetic. So let me back up. When you're in a sympathetic fight or flight state, your body's ready to run or fight, so it stiffens the muscles, right? That's what we mean by the tone. When you are in the parasympathetic or relax and digest state, it does the opposite. It turns down the tonality of your muscles. That alone is enough reason for me. I don't need a peer-reviewed research to understand the physiology. That alone is a reason to help somebody with your hands. Now, what if I have somebody with swelling? Fresh knee replacement, knee is clearly swollen, ankle swollen too. All right, there's a backup in the lymphatic system. Maybe there's pitting edema. So pitting edema is when you press on your ankle usually, and the skin should rebound. But if there's too much fluid in the area, mostly because of gravity and a blockage at the knee, then you get like an imprint that lasts for a few seconds or greater. Or if you see someone who takes their socks off and it looks like they're still wearing socks because there's the indentation of the socks, that's basically pitting edema. So for this, I'm using lymphatic drainage, manual lymphatic drainage. Now, lymphatic drainage it might feel weird or like not much. It's very superficial, as in light. The lymph nodes of your body are, well, basically everywhere you have vasculature, like arteries and veins, you basically have a network of lymph nodes and vessels. And it's a passive system, so it doesn't have a heart to circulate it, but that's what handles the swelling in your body. And let me just describe one other thing that's really important. Inflammation and swelling, this gets confused a lot too. So we kind of think inflammation bad, right? So that term gets thrown around, sort of falsely, or it'd be better if we separated the idea of inflammation and swelling. Inflammation is stage 1 of healing. You don't want to block inflammation. Systemic inflammation is a different story. But say you just had an injury, body's trying to repair, you want that inflammation to get to the site of the injury with all those white blood cells to start knitting things together. The waste product that's left over, that's the swelling. So it's important to differentiate that because we try to just block all inflammation. Just take an anti-inflammatory or put an ice pack on. I personally don't ice any injuries. I want the ambulance to get there, and I want to go in there and clean up mobilize the cleanup crew, essentially. That's the way I think of it. So manual lymphatic drainage can be very helpful here. And this looks like something like, again, we'll go back to a knee replacement. I would elevate the legs, so you're taking advantage of gravity because some of that fluid needs to go up towards your chest where you urinate it out eventually. So you basically lightly sort of cup the skin. You go from proximal to distal, and you just kind of work back and forth several times and hit the back of the knee as well. That's where there's a big collection tubular lymphatic system. I'm kind of getting a little too much in the weeds on what it is, but just so you know, if you've never had it, it feels very light because the lymph nodes are very superficial. They're kind of just underneath the skin. So it doesn't take deep pressure. I will also pair that with some belly breathing or diaphragmatic breathing because the cisterna chyli, which is like the main collection tubule of your lymphatic system, sits underneath the diaphragm. So when you do deep belly breathing, you pump that. So it's just a great way to get more fluid. It's almost like creating a heart for the lymphatic system. So the third way I think about massage and manual therapy is to improve range of motion. What limits range of motion? Well, several things. It could be swelling in a joint, but oftentimes it's muscular tenderness, I should say. So the muscle and or the tendon unit is maybe stiffened, sometimes in response to pain because the tone increases in that sympathetic state. So I want to decrease the tone in those muscles to improve range of motion. So, for example, if you are missing hip extension, so think leg behind you, as you know, like the trail leg in running, essentially, it's really common to be missing hip extension, maybe because your quad or your hip flexor is stiff. So let's just pretend the quad is stiff. So I would massage the quad, a lengthened position, and then I would stretch it, and then I would actively use it in that position. So I would do massage, hip flexor stretching, and then move into something like a Bulgarian split squat to activate the muscle in that deep extension actively. That's how you get to keep more of whatever you just stretched, is to get active into it immediately afterwards. So if you're a student listening to this and you are looking for a research topic, that's a really easy one. You could have a control group where you just stretch and do, maybe do hip flexor stretching and split squats. And group B would be manual therapy on the quad or whatever the limiting factor is, and stretch and do split squats and compare the hip extension. I guarantee you the second group is going to do better. So that's it. Those are the three reasons I use manual therapy to either calm down the nervous system, which overlaps with the other things, or to decrease swelling, or to improve range of motion. If you have any questions about this, reach out to me. I love talking about this topic, so just email me at chris@dynamicnaples.com. A ship in harbor is safe, but that's not what ships are meant to do. What does this mean? It means exposing yourself to difficult situations so you become resilient. If you need help building resilience, check out our flagship program called Physiologic Flexibility. This is a 3-month do-it-yourself program that teaches you how to maximize your homeostatic regulators, such as your pH, blood glucose, O2 and CO2 tolerance, and temperature. We give you specific action items through the program with the goal of becoming anti-fragile. If you want to become the inspiration for your friends and family, this is the program for you.